Tunnel vision is a hallmark symptom of options are A. Cataract, B. Macular degeneration, C. Glaucoma, D. Retinal detachment. The answer is C. Glaucoma. Glaucoma leads to peripheral vision loss, often described as tunnel vision. A patient with a stepladder pattern of fever and chills likely has options are A. Malaria, B. Dengue, C. Tuberculosis, D. Typhoid. The answer is A. Malaria. Malaria presents with periodic fever in a stepladder pattern due to RBC rupture. Oman sign is an indicator of which condition? Options are A. Angina, B. Deep vein thrombosis, C. Varicose veins, D. Cellulitis. The answer is B. Deep vein thrombosis. Pain in the calf on dorsiflexion of the foot is the Homan sign, which suggestive of the presence of DVT. Exophthalmos, that is bulging of eyes, is a hallmark of which condition? Options are A. Hypothyroidism, B. Hyperparathyroidism, C. Graves' disease, D. Myxedema. The answer is C. Graves' disease. Graves' disease is an autoimmune hyperthyroid disorder commonly associated with exophthalmos. Crushing, stabbing chest pain radiating to the left shoulder, neck, and arms that is unrelieved by nitroglycerin is indicative of options are A. Pericarditis, B. Panic attack, C. Myocardial infarction, D. GERD. The answer is C. Myocardial infarction. MI causes severe pain that doesn't respond to nitrates and is often radiating. A patient shows a rictus grin or rhizus sardonicus. This is indicative of which condition? Options are A. Rabies, B. Botulism, C. Tetanus, D. Stroke. The answer is C. Tetanus. Rhizus sardonicus is a sustained facial muscle spasm that gives a grin-like appearance typically seen in tetanus. What are the hallmark signs of diabetes mellitus? Options are A. Polydipsia, polyphagia, polyuria, B. Nausea, vomiting, weight loss, C. Hyperthermia, edema, dry skin, D. Bradycardia, hypotension, dry mouth. The answer is A. Polydipsia, polyphagia, and polyuria. Diabetes mellitus is characterized by three P's. That is polyuria, polydipsia, polyphagia, which is excessive thirst, excessive hunger, and excessive urination due to high blood glucose level. A patient experiencing heartburn is most likely suffering from options are A. Peptic ulcer disease, B. Gastric cancer, C. Gastroesophageal reflux disease, D. Appendicitis. The answer is C. Gastroesophageal reflux disease. GERD is commonly associated with heartburn due to acid reflux into the esophagus. Which disease is characterized by ascending muscle weakness? Options are A. Multiple sclerosis, B. Myasthenia gravis, C. Guillain-Barré syndrome, D. ALS. The answer is C. Guillain-Barré syndrome. GB syndrome causes acute ascending muscle paralysis, typically post-infection. Rose spots on the abdomen are a hallmark of options are A. Dengue, B. Measles, C. Typhoid, D. Malaria. The answer is C. Typhoid. Red spots, that is small red macules on the abdomen, are a classic sign of typhoid fever. Charcot's triad. Nystagmus, intentional tremor, and dysarthria is seen in which neurological disorder? Options are A. Myasthenia gravis, B. Parkinson's disease, C. Multiple sclerosis, D. Guillain-Barré syndrome. The answer is C. Multiple sclerosis. Charcot's triad is characteristic of multiple sclerosis, indicating central nervous system demyelination. Crushing, stabbing chest pain relieved by nitroglycerin is typical of options are A. Myocardial infarction, B. Angina, C. Pericarditis. D. Aortic dissection. The answer is B. Angina. Angina is due to myocardial ischemia and is relieved by nitrates like nitroglycerin. A barrel chest is most commonly seen in which respiratory condition? Options are A. Asthma. B. Emphysema. C. Pneumonia. D. Tuberculosis. The answer is B. Emphysema. Emphysema causes chronic overinflation of the lungs, leading to a barrel-shaped chest. What is the classical palpable sign in infants with pyloric stenosis? Options are A. Sausage-shaped mass. B. Olive-like mass. C. Soft bogey mass. D. Rigid board-like abdomen. The answer is B. Olive-like mass. Pyloric stenosis presents with a palpable olive-shaped mass in the right upper quadrant of the abdomen. Hi nurses. If you find the video useful, please like, share the video with your nursing friends, and don't forget to subscribe my channel Nursing Exam Insights, your ultimate resource for all nursing exams. Thanks for watching.